Health is a central concern, a right that unites all of the world together. Many countries around the world still struggle to provide excellent care to their citizens. Two of these countries that are doing well are the United States and France. Let's examine them closer. United States. Life expectancy at birth in years, 79.56. Mortality rate per thousand in population, 8.15. Infant mortality rate per thousand live births, 6.17. Per capita government expenditure on health at average exchange rate in U.S. dollars is $4,126.10. Government expenditure on health as a percentage of the GDP is 17.9. Main risk factors affecting health include obesity and physical inactivity. Major illnesses include cancer, diabetes, hypertension, and heart disease. France. Life expectancy at birth in years, 81.66. Mortality rate per thousand population, 9.06. Infant mortality rate per thousand live births, 3.31. Per capita government expenditure on health at average exchange rate in U.S. dollars, $3,608.70. Government expenditure on health as a percentage of the GDP, 11.8. Main risk factors affecting health are excessive tobacco use, excessive alcohol use, physical inactivity, and decreased intake of fruits and vegetables. Cancer is the leading cause of death. When combining cancer and illness, the daily disease burden is as follows: 19% for men and 15% for women. HIV infection is difficult to track due to a late implementation of a reporting system, but it still remains a major cause of illness. Hepatitis C and TB are still major causes of illness, but are declining. Healthcare is a combination of public and private financing. Public financing includes coverage for military from the government, Medicare coverage for older citizens, Medicaid coverage for low-income citizens, and coverage for children through state programs. Private financing includes citizens who pay cash for healthcare services, as well as citizens who are provided coverage through employer-offered private health insurance. Types of private insurance include HMO, PPO, and POS. France has a public health insurance program for all residents. Financing comes from employers, employee contributions, and income taxes. 75% of health expenditures are covered by the public health insurance. Remaining expenditures are privately paid by the patient either directly or through the use of private supplemental insurance, which is also paid for by the patient. The Department of Health and Human Services, HHS, is involved in many aspects of overseeing healthcare in the U.S. HHS runs several agencies that take care of different aspects of healthcare, including the FDA, or Food and Drug Administration, who regulates pharmaceuticals and food, Medicare/Medicaid, who is the largest government insurer, Centers for Disease Control and Prevention, or CDC, which prevents the outbreak and spread of diseases, and the National Institutes of Health, NIH, who do medical research, which is important all over the world. The government oversees the administration of the healthcare system in three ways. It negotiates the rate of medical expenses. The Ministry of Health oversees health insurance funds. And the National Agency for Accreditation and Health Care Evaluation issues recommendations and practice guidelines to ensure quality health care. Physicians per 1,000 people equals 2.5. Nurses and midwives per 1,000 people equal 9.8. Hospital beds per 1,000 people equal 2.9. Physicians per 1,000 people equal 3.2. Nurses and midwives per 1,000 people equal 9.3. Hospital beds per 1,000 people equal 6.4. In 2012, 47 million non-elderly citizens were uninsured. Most of those were low-income working families. Without insurance, these citizens do not seek or receive preventative care. As a result, they are at higher risk for chronic diseases, which in turn increase their health care burden. There is very little inequality in the French healthcare system. The government picks up approximately 70% of the costs, and most of the rest is covered by private health insurance, which most citizens have. In addition, the sicker you are, the more the government coverage you receive. Healthcare is for all. The only disparity is the lack of coverage for non-citizens.